Hello and welcome. You're watching Business Today TD. I am Sakshi Batra. We're leading multi-speciality pediatric and gynecology hospital chain operator Rainbow Children's Medicare. Shares have actually made a debut on the D Street, while the shares have listed at a discount of around 7% at 506 against the issue price of 542. The public issue was definitely subscribed 12.4 times during the April 27 to April 29 period. To discuss the future growth prospects of the company, I'm now joined by the company's management. Dr. Ramesh Kanchulia joins in. He's the chairman and MD of Rainbow Children's Medicare Limited. Good morning, and thank you so much for taking the time out for us on Business Today TV, sir. Appreciate you joining in.
Good morning, Sakshi.
So let me start off with the major point that everybody's talking about right now. The shares have listed on a discount. So what would you attribute this to? We've also seen a mixed response to the IPO. We saw QIB portion getting very, very strong performance vis-a-vis the retail portion. Could you give us a sense of why this muted listing?
So it's a healthcare company. It's a children's hospital. It's perhaps the first children's hospital company which is gone for the listing. So therefore, probably there may be some understanding, and people who have kind of seen and gone through our business, they know it. I think our children's healthcare is much required, number one. Number two is that what we have delivered over the last 10 years time, exceptional financial results. And our growth parameters been good, except in the pandemic here. I think the company overall, the prospects looking great. So in terms of today's, I think whether it's kind of opening low and those things is probably related to kind of market volatility and those things. That wouldn't worry me too much about it.
Okay, understood that. Now, you've raised 280 crores via the fresh issue this time around. How would you be using these funds in terms of growth for the company?
So we have the expansion plans about 500 beds to do in the next 3 years' time. So 170 crores of these proceeds from the primary is going to go for expansions in Hyderabad, Bangalore, Chennai, and NCR. And we have a 200 crores on the balance sheet that also goes for supports the expansion process. Second thing is about we have a 41 crores in CDs and debts to CDC, which is going to be paid. Some the 70 plus crores are going to be general corporate purposes. So it's essentially we do have a kind of cash on the balance sheet. So with the primary rise now that we have enough cash to do our expansions without any debts.
Absolutely. Also help us understand, sir, what are the growth opportunities in the pediatric space, which is your main focus? How big is the market right now in India, and what's the outlook going forward?
I think what we have seen in so far, we started as a 100-bed, 50-bed children's hospital. In Hyderabad today, we have about 730 beds, and we are needing more beds. So that indicates that every city requires a larger children's healthcare footprint. So we not only do just a basic children's healthcare, we also do a children's multi-specialties.
Right.
Whether it's cardiac or neurology or gastroenterology, any other problems. And also we do significant number of deliveries because what we believe in is the best place to have a child birth is a children's hospital. So they can hand over to the pediatrician, so in the children's hospital. So this concept has been kind of hugely successful in Hyderabad, and worked very well in Bangalore, and also done well in Chennai, and we are doing well in New Delhi. What we believe is that how we have done in Hyderabad, like a hub and spoke model. So that is to address the larger needs of the city. We would like to replicate the similar structure in Bangalore, which is tracking well, in New Delhi, as well as Chennai city. So this is how we're going to look at our expansion process, where we are not taking the huge risks going into the newer geographies.
Okay.
Where we are strong.
Okay. So also wanted to understand in terms of growth rate, could you help us understand what is the current healthcare industry growing at, and what is your own growth outlook for, say, next 2 years, FY23, FY24?
I can tell you that the pediatric market, so the pediatric market, especially by 2026, the pediatrics and the obstetrics is the total addressable market is going to be $36 billion by 2026, and which is expanding more than double from 2020. The second important thing is the private pediatrics and obstetrics is growing at a total of $22 billion. The 14% CAGR for pediatrics and 12% CAGR for obstetrics. So that is a macros for opportunity for us to do that. Another important thing is that, Sakshi, the children's health care, India is a huge nuclearization today because every family kind of nuclear families.
Yes.
They all have a significant, small families, 1 to 2 children. They would like to give everything to the children. And also almost all of them have a health insurance, either company provided or their own personal health insurances. The huge, richly kind of penetrated. For example, our business across the country, 50% is the private insurance. So that's growing year on year. So this is the overall opportunity for us in the country.
Okay, and what is the market share that you have currently, sir, in the pediatric segment, and what would you target to reach to?
It's very difficult to define the market share in pediatrics because we are still the pilot project where there are many people, kind of small nursing homes and those things are there. Now, real organized players in healthcare. For example, for Rainbow, isn't it like a competitive hospital as big as Rainbow, as with the breadth and depth of Rainbow? There isn't anybody. So therefore, that it is a nascent and growing model. So there was kind of concerns always been that either children's hospital been viable in the past. That's what we have been demonstrated very, very strongly that this is much required, and also it can give you financial results. You are able to demonstrate. That's why I'm here in front of you, going to public markets.
Absolutely, sir, and we hope so well for you too. But futuristically speaking, if you could help us understand, would you want to stay well within the niche of child-specific healthcare, multi-speciality healthcare and child-specific care, or diversify outside of childcare too?
Well, why would I do it? Because I'm a pediatrician. This has been built out of a lot of passion, a passion of many other young pediatricians. So we would remain to be within the niche area of children's and the maternal health care.
Absolutely. Could you also help us understand, sir, if COVID has, really enhanced the need for child-specific healthcare in India? What are the innovations that you're doing at the current sphere because of this pandemic? How things have changed digitally for you? And going forward, what are the new innovations that we can expect from you in this segment?
I think the pandemic, many bad things and few good things. So what has happened is the children remained at home. Unfortunately, they couldn't go out to the school or to outside or even to the play outside. So, and they stuck to the kind of the digital platforms. So that may have an impact, long-term impact for them, too much of a digital interactions and not less of a friends and social interactions. So we'll have to evaluate and see. Second important thing is that in terms of kind of accessibility to healthcare is definitely improved through the digital, because today anyone wants to reaches out to talk about their child healthcare problems within our geographies or outside the geographies or neighboring countries. They're able to reach to a doctor because the digital mode is an acceptable way of or consulting or conversation or opinions.
Absolutely. So since you said that, you're doing very well in Hyderabad, in Bengaluru, in Chennai, in New Delhi also, outside of these areas, are you looking at possible, expansion as well?
I think, we are not negative about anything, but we just try to see that, we take suppose we go into one city, we would like to do address the larger needs of the city rather than kind of doing 100 beds here and there. That's probably not kind of a very palpable when it comes to the Indian cities are very large. The states are very large. So therefore, an emergency specialty like pediatrics and maternal, so we need to kind of build out to the look and corner of the city.
Right. Could you also help us understand, sir, what are the growth levers going forward for you for sustained improvement in your earnings? Like you also pointed out, we know that your earnings have been very, very good. Profitability for the 9 months ended December 2021 increased substantially to over 126 crore rupees as well from 38 crore rupees last year in the same period. How would you be really looking at a sustained improvement of both profitability of margins going forward from here?
I think, see, as we mature our hospitals, our revenue mix will be better because children's hospitals, we have a larger portion comes from the outpatient revenue. And we do significant number of deliveries, which is a very small, short stay and higher revenue generating. We do a very care for the newborns, which are sick newborns, and also the sick children. So those are all the ones which actually generates quite a bit of money. So combination of all these things, with a shorter average length of stay in the hospital, it gives us a kind of as much as the average revenue per bed, closer to some of the high-end multi-specialties.
Okay.
We've always done the average revenue per bed better than mid-size multi-specialty hospitals. We would be kind of somewhere sitting closer to the bigger multi-specialty hospitals. So that way there is no issues because it is revenue generating. But important thing is that the model which we have taken is entry barriers are pretty high because our hospitals, all our doctors work full time.
Yeah.
Also, they've committed to do the night on calls as well, and they do not work elsewhere.
Okay.
So it's a pretty ring fenced this one because that is the kind of a commitment and convictions are required for a children's health care and a sick children to have a better results. So this is what made an younger parents kind of for them we have become very reliable and very trustworthy hospital chain.
Okay, understood that. Well, on that note, thank you so much, sir, for speaking to us and for sharing all the insights from your growth perspective. All the very best to you. The listing has been muted, but we hope for better returns for shareholders even going forward on the back of the earnings visibility that you have shared with us. Thanks a lot for speaking with us.
Thank you, Sakshi.
If you like the video, do like, comment, share and subscribe.